The mind is not a vessel to be filled, but a fire to be kindled. A quote from Plutarch. Welcome to AHS Guide, your companion for mastering the first year 5 subjects based upon Rajiv Gandhi Health Sciences University. We make complex concepts simpler, easier, and clearer to understand and be exam ready, helping you to learn smarter and try scoring better and to build a strong healthcare foundation. In today's lecture, we'll explore a crucial aspect of blood physiology, which is blood grouping and transfusion medicine with RES and spleen and lymph. Our focus will be on the blood grouping, understanding the ABO system and its clinical importance, the RH blood group, its genetic inheritance and the medical significance, blood typing, the laboratory methods that is used to identify an individual's blood group, the hazards of mismatched blood transfusion, why compatibility is vital and important, and what are the complications it can arise if the blood groups don't match. We also see the various organs like reticuloendothelial system. Then we'll be studying about the spleen as well and lymph. So by the end of the session, we'll be having a clear picture of how blood grouping and blood groups are classified, how the blood typing is performed, and why safe transfusion practices are important and life-saving. So the first topic, which is ABO blood group system, it was discovered by Karl Landsteiner, and based upon his discovery, we can understand that the blood groups are determined based on the presence of the antigen on the red blood cell. If there is an antigen A, it is A group. If there is an antigen B, it's a B group blood, B type blood. Now, naturally occurring antibodies IgM are present in plasma. These IgMs are going to be against opposite to the whatever blood that is outside. So here is a table of how the blood group and the antibody that is present inside, antigen that is present inside the blood system can be observed. So in blood group A, RBC, that is red blood cell, has the antigen A on the surface of the RBC. Now, if the antigen A is present in the RBC, then anti-B bodies or antibody B is present in the plasma. So, you cannot transfuse a B group blood to the A group blood because there is antibodies against B group. It can kill the B cells and cause the hemolysis. It can be fatal and can lead to death if the transfusion is not monitored when the signs and symptoms are observed inside the body. Now, these A group people can receive blood from same group or from O group people, because O doesn't have any antibodies, antigen on it, and the both anti-A and anti-B are present, and there is no reaction that can happen. Now, blood group B has B antigen on red blood cell. There is an anti-A plus antibody in the plasma, and they can receive from its own blood type or from O group. Now, blood group AB has both A and B antigen, and there is no antibody as such present in the AB blood group, and since they don't have any antibody acting against any blood type, they are universal recipient. That is, they can receive blood from A, B, AB as well as O. Now, O blood group people have no antigen on their red blood cells, and since they don't have any antigens on the red blood cells, they are very sensitive and cannot has both anti-A and anti-B antibodies inside the plasma, and they can only donate blood as such and can receive only from their own good blood type, and no other blood type can be transfused to the O group people. So from this you can conclude that the universal recipients, that is people who can receive blood from all blood types, are AB, and the universal donor, that is O blood type, can donate to any blood group people. But while transfusion is happening for O group, O only should be given as a transfusing blood. Now here is an image of what all I explained. So type A blood group has A antigen in their RBC surface, and there is plant anti-B antibodies in the plasma. Similarly for type B, B antigen on RBC, there is a plasma antibody anti-A. In type AB, it has both A and B antigen. Plasma antibodies, none. And in type O, there is no antigens on the red blood cells, but they have the anti-A and anti-B antibodies in the plasma. Now here is the test of how you are going to conduct and find out whether the person's blood is which A, B or AB. Now you are going to put anti-B serum onto A and B as well as on the RH antigen for the finding out whether it is a positive blood or a negative blood. So here you can see there is agglutination forming on the A body, red blood cells. The antigen antibody are being attacked on each other, and there is a breakdown or hemolysis that has happened, and there is granule formation. But with the B type, since anti-A is present in the B blood group and there is no reaction that is happening, B remains still. But from this you can understand that the anti-B has acted against the antigen B. So that is how you are going to understand the laboratory mechanism. Now, RH blood group system based on the RH antigen, that is the D antigen that is present on the red blood cell membrane. The presence of RH or D antigen is going to be positive, RH positive. If the D antigen is absent, then it is RH negative. Unlike the ABO grouping, here RH antibodies are not naturally occurring. They are formed by only after exposure to RH antigens. That is, like in the transfusion and pregnancy, only the RH antibodies act. But here in the ABO blood group, if you transfuse A for A blood type with B blood group, then the reaction is observed then and there. But for RH to react and create antibodies, it has to be exposed to the RH antigen only. Then only the antibodies act against each other. So RH factor is also called as rhesus factor and is a type of protein that is present on the red blood cell. If the presence of RH factor on the red blood cell, it is RH positive. If not, it is RH negative. Now, RH incompatibility is one such thing that you have to observe. In pregnant people, pregnant women, there is RH negative mother and she is carrying a RH positive fetus, that is the baby. The mother forms anti-D antibodies after exposure to the fetal blood. In subsequent, the RH positive pregnancies, the antibody crosses the placenta and attacks the fetal RBC. So the result is a hemolytic disease of a newborn, erythroblastosis fetalis. So this is a condition where the baby is going to be killed by mother's own blood. So technically here you can understand that if the mother is a RH negative, say she is a B negative blood group and the baby born is going to be a B positive blood group, or AB positive or any positive group blood group a baby is being born, then the mother's anti-D antibodies are going to act against the fetus blood or the baby's blood on exposure to the blood of it. Once the RH positive fetus is being attacked, it is going to cause the disease which is called erythroblastosis fetalis. So in this case, in future, if the mother is going to conceive, the antibodies can cross the placenta and kill the baby in the womb itself. So this is a disease that can cause certain symptoms in the fetus as mentioned below. The the fetus or the newborn can acquire anemia, jaundice, hepatosplenomegaly, hepatosplenomegaly, and hydrops fetalis. So these are the blood related conditions that can be observed if the Rh negative mother gives birth to a Rh positive fetus. Now, how to prevent the hemolytic disease of the newborn, that is to prevent erythroblastosis fetalis, anti-D immunoglobulin ROGAM is given to the Rh negative mother at 28 weeks and within the 72 hours of delivery. So this anti-D immunoglobulin IgG is given to the mother at 28 weeks and within the 72 hours of delivery to prevent the reaction of Rh negative or the anti-D antibodies from the mother, which is going to attack the fetus. So this is the diagrammatic representation of what erythroblastosis fetalis might occur in a negative Rh negative mother. How is the blood typing done? Blood typing is a diagnostic or a method that is conducted in the laboratory before a blood collection, blood transfusion, or blood sampling is done. Here, the ABO and the Rh typing must be done before the transfusion is occurring. So it involves mixing the blood samples with anti-A, anti-B, and anti-D sera. So you are going to put drops of anti-A, anti-B, and anti-D serum into the blood, that is a drop of blood, and check whether the which type of blood group is present. If the agglutination happens, the presence of that antigen can be detected. So if agglutination is the attack of if in case you have a blood group, you put anti-A into it. So since the plasma of the A blood group has anti-B bodies and anti-A is being added, anti-A serum is being added to it, anti-A and anti-B attack each other and there is going to be a agglutination formation. So this shows the presence of the antigen B. If the antigen B is present, it is a blood group A. If antigen A is present and the anti-B shows the reaction, then it is a B blood group. So that is how you are going to detect whether the blood group is having A or B type. Now for the Rh typing, if anti-D serum is being added and there is a formation of agglutination, then it is an Rh negative or Rh positive. So here is an image of how the agglutination looks like. So you're going to add anti-A to A, anti-B to anti-A to B, and the anti-D serum to the all the 3 dots of blood, 3 drops of blood group, and you're going to mix it up and find out the agglutination. The dot structure you see, that is the agglutination. So when the agglutination is occurring, since the anti-B has acted against the anti-A sera, there is agglutination in the first drop. So that shows that that group is A positive. And there is agglutination over here and it is positive for Rh. So there is presence of Rh antigen on the red blood cells. This shows the A positive. Similarly for B positive, O positive and AB positive. So that is how blood typing is done. Now we have cross matching. Cross matching is to ensure that the donor's blood is compatible or suitable for the person who is receiving the blood, who is a recipient. Now the major cross match that is done, it is usually done in the laboratories to avoid any complications during the blood transfusion is happening. So this is a primary test that is done between the recipient's blood and the donor's blood. So recipient serum is taken and the donor's red blood cell is added. So you can detect any antibodies that are being produced by the recipient against the donor's red blood cells and killing the donor's red blood cells. So it will be a waste if the blood is not being accepted by the recipient. Donor's blood is not being accepted by the recipient. Now the minor crossmatch here, the donor serum plus the recipient red blood cell is added. So the opposite. Here the donor serum is taken, and the recipient's red blood cell is added. Here again, there is if the antibodies are detected in the donor, it is less common, but it is usually done to determine whether the donor's red serum or the antibodies are going to act against the recipient's red blood cells and kill the person who is kill the person's red blood cells who is receiving the blood. So usually major cross match is preferred than the minor cross match, because major cross match involves the recipient serum, wherein the patient who is receiving the blood might show any reactions against the transfusion blood. So here is an image of how blood typing is done and the compatibility is performed, test is performed. Here the anti-A, anti-B and anti-D is added and the agglutination in anti-D is observed, so it is A positive. So there is no antigens present in the A, B and the control. You can see each and every test that is being conducted and find out which blood group and how is it determined. Now, coming to the compatibility or cross compatibility, a donated blood is having A positive or AB positive, then the receiver can receive AB, A plus, A negative, O positive and O negative blood. And O positive people can donate to O positive, A positive, B positive and AB positive, and they can only receive from A positive and A negative type. So that is how a compatibility test is done to determine which all blood groups can receive blood and can donate to which all blood groups. The hazards of mismatched blood transfusion. This is a major concern that is kept in mind whenever a transfusion reaction is observed by a wrong blood that is being transfused, or there is no improper vigilance that is being taken while doing a blood transfusion. So the hazards of mismatched blood transfusion can be studied in two methods. One is acute hemolytic transfusion reaction or delayed hemolytic transfusion reaction. So acute, as it says, in short term, the reaction happens as a major issue and it is a very short term and it takes around minutes to hours for the reaction and the symptoms to be seen, whereas delayed hemolytic reactions can be seen after a week or a month. Usually after a week. Now, acute hemolytic transfusion reaction is due to the ABO incompatibility and IgM mediated. So here the incompatibility is seen whenever the ABO blood group is not being cross-matched properly and tested, and if the incompatibility is observed in the blood typing, then IgM mediated, that is the antibody antigen mediated plasma reaction can be observed. Here the symptoms that are observed will be in minutes or hours. So when the transfusion is happening, within minutes you can observe the reaction, wherein the patient might have fever, chills, he might complain of back pain, or there may be hemoglobinuria, which is blood in urine, and hypotension. There is sudden low BP and acute renal failure, that is the patient might experience kidney failure. Kidney failure can be detected when the back pain is observed and the urine is filled with the red blood cells, hemoglobinuria. Delayed hemolytic reaction is usually after post the transfusion, and after a week of transfusion the symptoms are seen. Here it is IgG mediated and usually from the RH or minor antigen mismatch. So if the patient is being transferred with a RH positive or a negative, the opposite of it, the IgG mediated antibody antigen reaction is observed. It is due to the antigen mismatch or due to the RH factor. Now the transfusion reactions can be studied as three acute and delayed hemolytic reaction. So in acute hemolytic reactions, the main symptoms are being shown in the diagram, wherein a systematic one has fevers and chills. The vascular might be about hypertension, that is low blood pressure, and there might be uncontrolled bleeding, internal bleeding, which shows as purpuras. Transfused vein, the heat sensation is observed, and that is when you observe the fever. Lumbar pain, which is there is pain in the back. Urinary, it is related to hemoglobinuria, that is blood in the urine. Then hyper bilirubinemia, that is there is excessive release of bilirubin into the urine urinary tract. Then we have chest, there is constricting pain. Heart, there is increased heart rate. So these are the symptoms of acute hemolytic anemia. So these are the main symptoms of the acute hemolytic reactions. Moving to the transfusion reaction, which occurs within 10 to 15 minutes, you can observe allergic, fibrillar, and hemolytic reactions, the same as the acute, the symptoms wherein I have put forth here. But here is how the reactions can be seen physically. Now, if there is an allergy, the patient is going to start having scratches on his body. You can observe face flushing, that is, his face can become red. Hives or rash can be observed, that is, the redness and the rash is observed on the patient in the first 10 to 15 minutes. Now, the febrile reaction that you observe is there the patient might experience headache, tachycardia, that is increased heart rate, tachypnea is increased breathing, the patient is not able to breathe because of the constriction of the chest wall. Then the patient experiences fevers, chills, and anxiety. Finally, the hemolytic, here again the chills, fever, and tachycardia. There is going to be decrease in blood pressure and increased respiratory rate, which is tachypnea. Then the patient might experience headache, chest pain, apprehension, and low back pain. So these are the hemolytic reactions. Now, how do you react to the mismatched transfusion? The first thing that has to be performed is to stop the blood flow. So whatever the blood that is being transfused to the person should be stopped then and there, and a NS or the normal saline should be flushed through the blood system in order to dilute away the mismatched blood. So that is the first precaution that is being taken whenever a mismatched blood is transfused into the person's blood. Now, febrile non-hemolytic reaction, due to the cytokines or WBC or WBC antibodies, a common mild fever and chills are observed. These are non-hemolytic reactions that you observe due to the presence of cytokines or the WBC antibodies inside the blood, which act against the incoming mismatched blood. That happens by attack on the blood that is being transfused. So when this attack is happening inside the blood, there is mild fever and chills that are observed. Allergic reactions due to the plasma proteins and rash, urticaria, and rarely anaphylaxis. The allergic reactions is observed because of the plasma proteins that are present. These are shown in the form of rash and as I told, urticaria, and anaphylaxis is also an allergic reaction that is being observed. Now, the transmission of infection. So this is another hazard that is being observed whenever the primary screening is not done with the rapid test for HIV, hepatitis B or hepatitis C or the syphilis. The rapid test must be conducted once the blood donation is being done. The sample of the blood should be taken and a screening should be done before transfusion is conducted. So the risk of transmission of diseases, very infectious diseases like HIV and HPV are bloodborne. So without screening and transfusing can lead to transmission of the infections. Now, TRALI is another hazard, which is a transfusion related acute lung injury. It is caused by transfusion of the blood which is mismatched and can lead to sudden lung edema and immune mediated response all over the body. So as the word says, transfusion related acute lung injury, the lung injury is going to happen within minutes, and it doesn't take weeks to get show the reaction, but it's going to be sudden attack on the lung wherein edema, that is filling of water in the lungs, and it can cause immune mediated reaction all over the body, which is fatal as well. It can lead to death if not treated on spot or taken it seriously and handled by the doctors. Now, the iron overload is another chronic transfusion related hazard. Here, if the iron overload is not checked, that is the amount of blood that you are transfusing and the patient's blood iron levels should be maintained at a constant level at normals. If it is overloaded, then the patient is going to suffer sickle cell thalassemia, and sickle cell patients are usually going to have the transfusion related risks if the iron overload is done. Now, here is an image of how a lung edema is caused, how the lung edema looks like in an X-ray due to the transfusion related acute lung injury, TRALI. And here we have organs that might be affected due to the iron overload. So iron overload can affect the pituitary gland, thyroid and parathyroid gland, adrenal glands, heart and circulation, liver, pancreas, testes, and ovaries as well. So there is toxic iron buildup all over the body, and it can lead to serious damage of the important organs that is inside your body, such as like heart and liver as well. So these are important for the normal functioning of the human body. So if the iron is going to build up inside these organs, there is serious damage to these organs, and it may be fatal, and the patient might die because of iron overload. So everything should be vigilantly performed and should be rechecked and perfectly done before a blood transfusion is being conducted. RES, or Reticuloendothelial System, mononuclear phagocytic system. So what is this RES system? This is the last topic of your blood chapter of physiology. And what is RES? RES is the phagocytic cells like monocytes and macrophages that is found in throughout your body. It is involved in defense, clearance, and recycling of cellular debris and pathogens. So every cell that dies in your body is going to be defended against any infections. They are cleared out by consuming and recycled if any cells are having any energy left in them. So that is the work of a RES system. So what are the key components of RES system? There are monocytes in the blood, macrophages in the tissues, like Kupffer cells in the liver. So in liver, the Kupffer cells, alveolar macrophages in the lungs, microglia in the central nervous system, and Langerhans cells in the skin, osteoclasts in the bone. So these are going to consume the cells that are dead or forming a cellular debris. So important ones, and dendritic cells sometimes, and reticular cells in the spleen and lymph nodes. So these are the important key components about RES system. Moving to the functions of RES system, phagocytosis of the microbes and dead cells, antigen presentation to T cells, cytokine production, recycling of iron from hemoglobin, and clearance of the old RBC is mainly in the spleen. So what is the work of an RES system? It's going to phagocytosis. Phagocytosis is consumption or engulfing the microorganisms or the dead cells present in the body. It also acts as an antigen presentation to the T cells. So it provides an antigen uh, for the antibodies that are produced and are going to attack the cells or the microbes. Cytokine production and recycling of iron from the hemoglobin. So whenever RBCs break down and release hemoglobin, the iron from the hemoglobin is taken up and recycled. Next, clearance of old RBCs. Whatever old dead RBCs after 120 days is being sent into the spleen, and in the spleen they start going to be degraded and deleted out of your body. Now spleen. The spleen is one of the largest lymphoid organ, and it is located on the left upper quadrant of abdomen, surrounded by a capsule, and is highly vascular. So since spleen is the dead graveyard of RBCs, that is where all dead RBCs come and are deposited over there. So all the RBCs are dead over here. Okay, so where is it located? On the left upper quadrant of abdomen. You can see the pink color radiating radiating organ in the diagram. Now, how is it looking like? It is like a white pulp. It is a lymphoid tissue, and it has T and B cells that are always vigilant over there. Vigilant in the sense T and B cells are always actively participating in the spleen. Next, there is red pulp as well, which helps in filtering the blood, and it contains a splenic cords and sinusoids which help in the transfer of the blood and filtering of the blood. They also remove the old and damaged RBCs, and hence it is called red pulp. And white pulp is the lymphoid tissue which carries out all the waste products from the RBCs that are being removed. Now, what is the function of a spleen? It helps in the filtration of the blood, and it functions as an immune response. It helps in phagocyting of opsonized cells. Opsonized is dead cells, and opsonized is dead cells or killed cells, and storage of the blood cells like platelets, monocytes are also stored in here, like the T lymphocytes and B lymphocytes. Then hematopoiesis in fetal life. Hematopoiesis is production of RBCs in fetus. Okay, so that covers the functions of spleen. Now, what are the different clinical aspects that you're going to see in spleen? There is enlarged spleen that is caused due to infection or some hematological disorders. The spleen might be enlarged and cause a splenomegaly. A splenia or splenectomy is done to remove the spleen. So this is a surgical procedure wherein spleen is removed. If the spleen is removed, there are chances of sepsis. Sepsis is bacterial infection. So if the spleen is removed, the region where the spleen is removed, the sepsis might happen, and it might require a vaccination or prophylactic antibodies to prevent the bacterial infection at the site of spleen removal. Surgical spleen removal. So this is a spleen. You can see the white pulp and the red pulp which I explained. So this is the white pulp, the white region, and the pink color region outside is the red pulp, and there is a capsule. There are arteries and veins that bring in the dead blood cells or the oxygenated blood for the spleen to work efficiently. Now this is a surgical procedure where spleen is removed. And splenomegaly is the increased size of the spleen, the normal healthy spleen and the splenomegaly. So that covers the spleen. Now lymphatic system we'll be covering in the next video. For today we'll be doing this much of the video. Thank you for listening to the whole chapter of blood physiology from jaundice, anemia, immune system. We learned about WBCs, platelets, and various other topics. The blood transfusion and the reactions to it, as well as the different RES system and spleen. So these are the different topics, subtopics that are given in your Rajiv Gandhi website. The syllabus covers so much about blood. It is very much important to learn about blood because it's a circulatory medium. It is the only part of your body that does the circulation and transports the nutrients, oxygen, minerals, as well as it is acting as an immune system as well, defense mechanism. It is also helping in the normal homeostasis as well. So this is very much important chapter, and it fetches a very good amount of 15 to 20 marks from this chapter. You can expect aram se. So concentrating on these chapters is going to help you very much to score well in your exams. If you feel that the topic was very much difficult to understand, there are notes link provided down in the description. Go to the description, download the notes and study it, as well as watch the video to understand the in-depth concept of what is being done. So certain concepts are important. I have specified them that they are important. You can go back to the PPT and make your own notes and try to learn the concepts. For concepts like hemostasis, it is important to learn the charts that I've put, the diagrammatic charts that I've put, because these charts are going to simplify your answers and are going to fetch you more marks in the exam as well. For the rest of the thing, for the revision part and the notes part, I'll be uploading in the weekends. Please subscribe to the channel in order to get the utmost sources that I'm trying to provide you guys, and please share it among your friends as well in order to grow the tribe, and the subscribers can understand the very need of what the syllabus is. Thank you. Bye.